So thank you all for attending. Welcome to the Working Towards Equity and Justice student panel. This panel is sponsored by the Diversity, Inclusion, and Belonging Committee in the Social and Behavioral Sciences. And this is one of our several panels that we do during National Public Health Week. So to introduce myself, my name is Noah Southard. I'm a graduating public health major, and my role here with the DIBS Council is program development and implementation. I'd also like to thank Cash Evans and Lila Drexilius, who are also program development and implementation interns here. So for our panel today, we're going to introduce our panelists. And during the panel, if you have a question, feel free to put it in the Q&A section, and I'll read your questions out to our panelists. So we have three panelists today, Tiffany, Tamia, and Francis, and each of whom are going to talk about the work they're doing and how they are advancing health equity and justice in the city of Philadelphia. So we'll start off with Francis. If you could just introduce yourself, your organization, and the major project that you're working on.
Yes, my name is Francis Schulenberg, and I have some materials prepared, so I will just open that up. Okay. Can everyone see that? Okay. Yeah, okay, cool. All right. So, okay. So I work for Pennsylvania Nutrition Education Network as the undergraduate intern, and at Penn, we mostly focus on SNAP and SNAP Ed, and my main role is creating maps. So I've titled my work SNAP and Maps. So I work for Public Health Management Corporation, and under PHMC is the Pennsylvania Nutrition Education Network, which is oftentimes referred to just as PAN-N. PAN-N is the only statewide SNAP Ed provider in Pennsylvania. And just for some context to make sure everyone is on the same page, SNAP stands for Supplemental Nutrition Assistance Program. So the work that I have been doing with PAN-N is using GIS, or Geographic Information Systems, to analyze relationships between SNAP recipients, social vulnerability, and health behavior data. And GIS is a data visualization software that allows everyone to kind of see any sort of data. So whatever you want to present, you're able to present it in a digestible way. So the scope of my work first involves this panel, and then in a month, I'll be doing a SNAP and Maps webinar, which will be partnering with a local organization discussing GIS dashboards, survey data, and kind of the importance of utilizing GIS in our work. And then I will be discussing my own findings of the maps I've created. And then the goal is to go into a GIS introduction and a beginner tutorial, so the webinar watchers can kind of walk away with an idea of how to use GIS in their own work. I will also be creating a story map, which is pretty much just like a virtual interactive site where you're able to explore the different maps that I created, get some takeaways, and find some resources as well. So the goal with that is to distribute to community partners and SNAP Ed recipients so that there's a more educational and cohesive site for individuals. And I will also be discussing my work via poster board at the Hunger, Nutrition, and Health in Pennsylvania SNAP Ed conference in June. So this is one map that I wanted to share with everyone. So this map shows the percentage of population receiving SNAP benefits by Pennsylvania County. So this map uses graduated colors, which basically means that range from the dark blue to the yellow. So the yellow represents that 25 to 29% of people living in Philadelphia County are receiving SNAP benefits. So that is the highest percentage. Areas surrounding Philadelphia do have some of the lowest percentages, between 4 to 9% of people receiving SNAP. And yeah, so this is a good way of displaying data in a pretty easy to understand method. But one thing that is important to keep in mind with this map in particular is that this map is showing SNAP benefits, so people that are enrolled in SNAP, but it's not necessarily speaking to the amount of people that are qualifying for SNAP. So that would likely be, higher percentages because more people might qualify for SNAP than are actually enrolled in the program. So this next map kind of touches on some themes that I have been working with, which is social vulnerability. So the CDC gathers their census data to determine this overall risk, which is known as the social vulnerability index. And then this index uses data like socioeconomic status, household characteristics, racial and ethnic minority status, and housing type and transportation. So this map shows that composite score, that cumulative rate of social vulnerability. So the darkest red is the most socially vulnerable areas. So Philadelphia County is in the most vulnerable section, but there are lots of other counties in rural Pennsylvania and center Pennsylvania, and as well as Erie County and the Northwest. So this is just a good way. So it's again, graduated colors. It's an easy way to understand what you're looking at. And then I use that same data, the social vulnerability index, to create this cluster analysis map. So unlike the first one that I just showed, I'll go back. It's hard to take away what exactly are the most at-risk areas. You can see county by county data, but it's hard to get a larger overall kind of mission. So here, there are clusters. So that's the light pink and the light blue are the clusters. So that's where there's a high cluster of individuals that are living in a socially vulnerable area. And then the light blue, which is really hard to see in this view, but it is specifically in central areas of Pittsburgh as well as Philadelphia, which is slightly misleading because pretty much it's just incorporating those census tracts where there's no one living in it. So it does look significantly lower than the areas around it, but only because very few people are living in it. So with data, it's important to make sure that you are aware of kind of the limitations, and that is definitely one of them. But I do like this map because it gives a better overall view of areas in need of outreach and resources. The only thing, kind of the other thing that I would definitely wanted to point out is that it potentially overlooks certain communities that are in proximity to low risk or high risk areas. So if I was living in southern New Jersey, the census tract that I lived in might say that it's this not significant white census tract. However, it might be only saying that because it's in proximity to the high clusters found in Philadelphia. So it's important to keep in mind that this is a good map for kind of a statewide or community level analysis, but individually, it doesn't speak to, the people that are living in high risk areas that might be doing okay versus people that are living in low risk areas that do need more resources. So individually, maps do kind of have that shortcoming. So this map uses multivariate cluster, which is basically a way to analyze two factors at once. For this particular map, I've used social vulnerability index, so what I was talking about before, as well as the density of SNAP recipients. And then it takes those two factors and gives you a 9 color shades to determine low risk and high risk areas for both of the factors at once. So it's not necessarily the most intuitive. You kind of have to look at it and really see what you're understanding, but it does help in terms of visualizing two factors at once. So the darkest orange in the top right corner of that key represents people or counties that are most socially vulnerable, but also have a high density of SNAP recipients. So that is in Northwest counties as well as Philadelphia and scattered across the state. But then within this multivariate cluster analysis, you are able to see as well areas that are highly a high SVI, but have fewer people that have SNAP. So there is kind of that variation that is helpful to understand. Likewise, the light orange counties, you can see lots of people receiving SNAP, but a lower social vulnerability index. So that is helpful too, because you're able to see if people need more of a connectivity to resources. Let's say that someone is living in an area that has a low social vulnerability index, but a high density of SNP recipients, potentially those are the communities that need more outreach because comparatively in the county, there might not be a lot of vulnerability, but there might be a lot of SNP recipients. So those are all some things to keep in mind with a map that looks like this. And sort of my overall theme, especially in terms of social justice and health equity, is data transparency. So there's an acknowledgement that data that informs citizens is not always available for citizens. So in my experience, a lot of the data I found was available in Excel files or shape files, and it really wasn't digestible or understandable, which is an issue because then people can't see data that impacts them in their communities. Additionally, data is not always publicly available. Sometimes the data I was looking for wasn't easy to find, or there was a password, or you needed access. So all of those factors definitely do limit the public from understanding the data that surrounds them. And then this is just one quick example of a spreadsheet that I downloaded. So it is largely confusing, and there's a lot of like codes that unless you have, the outline right in front of you, it's really hard to understand what they're actually studying. So there's like E total population, which is estimated total population, but then there's also M total population. So there's like a lot of confusing variables that are not easy to digest. So that is something to keep in mind. So the outcomes of my work at PanN is to create a comprehensive, accessible, and educational site for SNP-Ed users that compiles data findings, community resources, and contact information. And then also the SNP-Ed Maps webinar will serve as an introduction to GIS capabilities, which I'm really excited for because GIS is something that's really exciting for me, and I'm excited to be able to share that and make sure that people can kind of walk away with a basic understanding of how they can use GIS in their work. And then finally, efforts to summarize and share data is a step in minimizing gaps among researchers, practitioners, and communities. So thank you, everyone. If anyone has any questions, here's my email, and I think also can type it in the chat. So thank you, I appreciate it.
Thanks so much for sharing. Again, if anyone has any questions, feel free to put it in the Q&A and we will read them out. So let's move on to Tiffany. So Tiffany, if you could share your screen, or if you have
Hello, nice to meet everyone. Thank you for coming to the panel. My name is Tiffany Nguyen. I am right now also a graduating student with my bachelor's in public health this semester. I am currently interning at Joseph J. Peters Institute. I want to give a little bit of a brief history and a little bit of a background for the agency. So JJPI as a whole is a multi-site nonprofit community mental health organization that services not only Philadelphia, but the surrounding counties. They offer different modalities of treatments that are evidence-based to help clients on their journey of recovery and healing. And they also are experts in all forms of trauma, including but not limited to intimate partner violence, exposure to community violence, human trafficking, sexual abuse, and so on. So a brief history, the founder, Joseph J. Peters, was actually a psychiatrist and assistant clinical professor at University of Pennsylvania School of Medicine back in the 1950s. The organization was chartered by the City of Philadelphia's Department of Public Health as the Institute for Sexual Deviance back in 1968 and was later renamed Joseph J. Peters Institute in the honor of the founder about 3 years after his death in 1979. And since 2004 has been an affiliate company with PHMC in the city. So their mission is to restore hope with dignity, and they do try to put an emphasis and prioritize their evidence-based treatments They try to have a robust approach to client care to make sure that they meet clients where they're at, especially considering how diverse the city is and the surrounding areas are. They have locally actually 2 locations. One of them is at 100 South Broad at the Land Title Building on the 17th floor, called their Survivor Services Center, and their secondary location is at 1211 Chestnut Street, which is their Safety and Responsibility Centers. 100 South Broad services those who are covered under Medicare, which range from 3 to 65 and typically offer outpatient services, including trauma-informed therapy and other things like that. Their location at Safety and Responsibility Center at 1211 Chestnut deals with intimate partner violence perpetrators. This includes adolescents and adults who also have sexual behavior issues or were incarcerated for sexual offenses. So due to this, they do have a partnership with the Department of Human Services and also utilize multiple programs as part of the rehabilitation process for their clients. In terms of the community, they actually do a lot of food and personal product drives to promote outreach and prevention. They offer trainings to third-party entities. This includes kind of like a trauma 101 session, as well as how to identify and report childhood abuse with services like Childline. Their partnerships also include local school districts and other community-based health organizations. So what I'm doing specifically at JJPI is one of my major projects is I'm compiling a comprehensive file. It's about 40 pages long at this point, and I'm still going. But essentially, it's this huge file that has centralized resources for clients with times and locations that are for their convenience. And it's essentially resources that include websites, literature sources, community health agencies, national hotlines, and other resources for all ages. I've included topics to include resources for communities like LGBTQIA+, that include the Mazzoni Center right by campus, as well as the Trevor Project as an organization for resources. I've also included crisis centers in the city, as well as other resources that are surrounding housing, legal, meals and food distribution, as well as alcohol and substance use programs. JJPI as a whole right now, it's been really interesting interning there. So they're at the undergraduate level, their internships are primarily administrative assistants. And I think it's given me a really interesting insight in how nonprofit organizations work. How, although like not glamorizing administrative work can be, it is absolutely necessary, considering how a lack of funding can affect organizations like this. It can affect access to software, databases, how they hire people, what kind of grants and funding that they can get. And because they serve as vulnerable populations and they still utilize paper files, it's a little bit of a struggle, but we're getting there. An upcoming event that I'm actually going to help with is on April 17th in affiliation with Philadelphia's Children's Alliance, which is actually their first annual community conference. April is National Child Abuse Prevention Month. So with this event, we are hoping to raise awareness of childhood sexual abuse, safety tips, how to spot the signs, as well as current therapeutic interventions that are being utilized. It is going to be in the Student Center from 9 to 4 p.m. And that's it. If anyone has any questions, please let me know.
Thanks so much, Tiffany, for sharing. We'll move on to Tamia.
Hi, my name is Tamia. I am a senior at Temple University. I'm a public health major and a 4+1 student, so I'm currently working on fast tracking my master's in public health and social and behavioral science. I currently intern at a small nonprofit on Germantown Avenue called One's Up. It is a small nonprofit. We're a small team. We're in North Philadelphia, but we service all youth throughout Philadelphia. We have two programs. We have the CAT program, which is for youth ages 14 to 17. And we have a fellowship that's a year-long fellowship, and it services young people who are working but are not in school. And it's up to ages 24. Our goal pretty much is to turn passion into professions. I know it sounds like a little corny, but we want to get our teens and our young adults exposed to their passions directly through workforce development. But it's not just limited to building like soft skills like carpenting or things that could get them a job. It's about exposing them directly to their passion, directly to their field. So we may do that through certifications. We might get them, networking with people in their field and learning about what it takes to get to that point. Our youth recognizes, as we do, that like we're at a different level than other people. So we have to work twice as hard to get half of what others have. And we have to give youth the opportunity to grow. They don't have these experiences in public school. And so we give them extra tools and skills to propel themselves so that they can be competitive in the field that they're interested in. We also focus on wellness and wholeness. Black community deals with a lot of stress, especially in Philadelphia, as we've been experiencing an increase in gun violence. So we give them the opportunity and the tools to de-stress, to rest and restore themselves. And this stuff that they take, to their home, they are able to help their families with what they're dealing with as well. And we help them like cope with stress, recognize personal traumas, things of that sort. But this semester, this time that I've been interning, we've been having a lot of fun. I've been affiliated with One's Up for a few years now. This is my first time working with them at this capacity. And so the current CAT program, they're wonderful kids. We work with 8 kids from 14 to 17, and they are just a lively bunch. That's what I've been doing at my internship currently, actually, is working with programming and developing programming. I've been using a lot of my program planning skills and health education to develop the programming that we do. And I also help with like the community building, which I'm still getting invested in. The immediate community on Germantown Ave is definitely interesting. There's so many people to deal with, so many people to get to know and to like expose, like One's Up to, but as well as like going into the community and trying to figure out how we can help. Yeah, that's really it. I don't really know what else to talk about.
Thank you so much for sharing. We do have a comment in the Q&A, so I'll read that out. And it says, I want to congratulate both of you for working in the nonprofit field. I've been working in the nonprofit field for 40 years, and it is very hard to raise the funds needed. I would highly recommend senior students to look for working in nonprofits to get a great experience and training. And that's from Larry Rubin. So more power to the nonprofits. So again, if anyone has any questions, feel free to put them in the Q&A. I'll give everyone a minute to put some questions in. If not, I have some questions that I would like to ask. Tiffany, we have a question for you. It says, which organization are you working with?
Joseph J. Peters Institute.
All right, well, I have a question. Any of you can answer, or you can all answer if you'd like. And I heard a little bit about this from Tiffany, but what resources are needed most to enact public health in the organizations that you all are working with?
I guess I'll answer. We need a lot for the work that we're doing. Healthy food options, access to mental health professionals, money. I know that's bad, but we do, because it takes a lot to do the work that we're doing. And as we're working on like equitable, systems, we have to pay the people to do the work, and so that they're not burnt out, which is one of the things I've noticed in my internship. It requires a lot more work than, like the average job to work at a nonprofit. It requires a lot more time, and it's emotionally and physically draining. So those are just a few of many things that we need for our nonprofit specifically.
I can agree with Tamia. We definitely need funding. I feel like I'm always hearing about my preceptor just always grant writing at all hours of the day. And a lot of it is like, so from what I've learned is especially because JJPI is a mental health organization, we have to worry not only about being able to provide for the community and our clients and make sure that they in their journey to healing are seen and a proper care. We also have to make sure that our therapists and our clinicians also have, in that same capacity, they don't get burned out, because if your clinician cannot care for you, cannot care for themselves, like how can they care for you, kind of thing. So it's always kind of, we have to like, it's unfortunate that we have to like limit like caseloads and stuff to certain therapists. So as much as we want to take everyone in and heal all of the city, we can't. So it's unfortunate.
I would say that something that specific to my organization is that there is kind of a lack and gap in direct nutrition educators. So people that are hands-on teaching classes, working with schools and kids, that's, I think, a position that does face a lot of turnover, but those are kind of like the most connected to the community themselves. So that is a really important role. And the education portion of my work is crucial, even though it's not necessarily something that I'm doing directly. That is a very important role.
Thank you all. And Tiffany, there's another question for you. Could you give a quick rundown of what you do in the Institute, maybe kind of day-to-day roles and responsibilities?
At the undergraduate level, JJPI, their internships are primarily administrative assistants. They also offer internships at the doctorate level as well. They're more doctorate and I'm so sorry, graduate level, there you go. But they're like clinical hours. So due to that, I primarily just like help the agency with certain things, like helping. So besides like the resource guide, I'm also helping out in their medical room, where in their archival process. So because they still use paper files, I'm also helping create paper charts still. And it's just like something we have to go through because we don't have like comprehensive systems where we can just digitize everything. And even if we wanted to, digitizing costs us money. So it's like, it's that never ending circle.
We have another comment in the chat from Kathleen that says, excellent presentations. It's reassuring to know that the next generation of public health practitioners are so well equipped to address the many challenges we face. We have another question. Is it worth to have a volunteer for a short period of time, or is it more difficult because of the training?
Is that for all of us, or?
It's not directed at anyone, so.
I guess I'll say, I feel like it varies. It depends, what are you volunteering for, for how many hours, how invested you plan on being in the organization, is it something that you plan on moving from being a volunteer and maybe you want to work directly with the organization? I feel like it depends. In my opinion, we always need volunteers for small projects. For example, like in the beginning of my internship, I actually helped build the office. We revamped our whole office and recreated our whole space. And so we were here at all hours of the night, malleting and banging floors and painting. So we needed volunteers then. But yeah, it depends. And also if it's something that you're interested in too, you want to volunteer in the spaces that you're interested in, absolutely. Like get all of the knowledge, network, get to know everybody, because you never know what you're going to get out of an experience. Like what I thought I was going to get here, just being an intern, so much more than what I expected.
I think you made a great point. I definitely think nonprofits definitely need not only funding, but definitely volunteers to help keep everything moving. I also kind of went into the internship not really knowing what to expect. And I feel like I've learned so much about as part of the training helping with the archival process, I was able to read patient charts and stuff like that. And it's kind of crazy to see what is actually out there and how it affects people. And I feel like it has helped me strive more to want to provide for the community and to make sure that I am doing the best that I can, as tiny of an effort as it may be, but I feel like I'm doing my part.
Yeah, I totally agree with both of your responses. And I do think that especially for events and community outreach efforts, that volunteers are absolutely needed and welcomed.
And this is more of a, I guess, a looking towards the future-based question, but how do you all plan to use the work you're doing now in your future careers?
When I was searching for internships, I really wanted to get into data analysis. So I am very happy with the skills that I've learned throughout this internship and definitely want to apply them moving forward in a data analytic role.
I've always wanted to work with community health. So coming out of this, working in a community mental health organization, I feel like, because I'm coming from someone, I've always wanted to work also with marginalized communities, especially people who are of Asian descent. That's just, I have stemmed a lot of my public health inspiration from the experiences that I had growing up, where I would have to go do my mom's doctor's appointments in 5th grade and try to decipher what a doctor was saying, and not having health literacy to not only understand, but then to also translate it. So I've always wanted to work kind of more in health literacy, but then also the underlyings of that kind of mental health in POC communities and how it's not really talked about enough. And I feel like with my internship here and having really recognizing patterns and seeing how behaviors can escalate, how to mitigate or at least see treatment plans and see how people can see the growth of a person from when they're first admitted to when they're discharged and stuff. I feel like it's all nuggets of informational gold that I'm going to keep with me forever.
Same here. I definitely feel what you're saying, Tiffany. I always wanted to do community work. I didn't know at what capacity, but I knew that I wanted to work with Black people. Black people have a soft spot in my heart, I feel like as a Black person growing up, I recognize now where a lot of the gaps were that I didn't see, that I didn't have. I was without, and I didn't even know I was without. And I see that in a lot of the youth that we work with currently. Great kids, just beautiful souls who, if somebody could just spend a few extra hours out of their day with them and give them certain tools to help propel them into their life, and hopefully they'll come back and they'll continue to feed into the community. I'm from New York, so for me, I didn't get to do that in Brooklyn. I didn't have the wherewithal to do that then. And so being a public health major now, I feel like I can do groundwork here, and who knows if it even goes back to Brooklyn, that would be beautiful. Me personally, I do want to work within the Black maternal health field. And so that's where I feel like this is going to take me and help me get into those spaces, doing community work with Black women, birthing people and infants, where the mortality rate for infants and mothers of the Black community are extremely high around the country. So, sorry, my dog.
We have two questions. I'll start with the first one, which is, will any of you continue on with nonprofit work in your careers?
I think that, especially in the public health sphere, I feel like nonprofit work is kind of the foundation to some extent. So I think at some point, yes.
I would also say yes.
Same here.
Thank you all. And then one question here, how is the work that you've been doing in your internships compared to what you've learned in your coursework?
I think this is a really interesting question. We learn a lot in the public health curriculum. So this can go anywhere from health literacy, health education, practicing cultural humility, trying to be empathy forward when talking to children, potential clients, just people in your community that you see day to day. I think that a lot of what we learn in our curriculum are transferable skills. It may not match up 100%, but it's something that we can still grab out of things. So.
Yeah, and to piggyback off of that, I've been doing a lot of community program planning, and I didn't know that I was going to start applying it right away. I'm still in my part 2 of that course, and to see it even playing out, I'm really excited. I can't wait to do some of the stuff that Dr. Slashinsky taught us in health communications, because I was really interested in that, and I see it like working towards that. So I'm glad to say that at least my degree and the coursework is actually starting to add up now.
Yeah, I would also say that my education and the courses I've taken at Temple have done a good job of preparing me for the work that I've done here. I think also Temple's College of Public Health does a good job of allowing people to find kind of their own specific classes or minors or stuff. And that's allowed me to find, more specific skills that have interested me. So that has been very beneficial.
Kind of piggybacking off this question, what is one thing you've learned in your experience with your organization that you maybe wish you knew sooner?
For me, I think maybe just how important it is to separate your work-life balance. So because it's a community mental health organization, and if I start reading too many files of people who are there for trauma therapy, and it starts getting really dense and it starts getting really depressing. And I feel like it's really important to be able to kind of separate that work-life balance, not only for the sake of yourself, but for the sake of the people around you. You want to be able to have a strong head on your shoulders to be able to help yourself as well as to help others.
Yes, just had a Tiffany, you and I on the same page. How to deal with burnout. It's beautiful to be in the program that I'm in, but to have to do it while I'm doing a course and a writing intensive and another course just so I can get all of my credits. It's a lot, and I'm really excited to actually do the work in my internship, so it's hard to pull myself away. Once I start getting into the weeds of things, it's really hard to put it back down or to not take the work home with you. Even when I'm not on the clock, I feel like I'm on the clock.
I would say something similar, even though I'm definitely aware that my work particularly isn't like quite as emotional and heavy. I do feel like it's hard to balance school and work, which I'm sure a lot of people are dealing with. But one thing that is helpful is having some type of overlap between classes and what you're doing in an internship. I've found that to be kind of nice because I can learn a skill in a class and then directly use it in my work.
Thank you. I think that's some really good advice. And so in terms of community engagement and community involvement, are there any opportunities for community members, for students, high school students, Temple students to get involved in your organizations?
At my work, there is a few open positions, and I can follow up with you if that is helpful and email to people that have attended this.
For our work as well, we aren't currently taking any teens for the CAP program that's going on currently, but we will always need applications as it moves forward. I think they might be adding another one. I could be lying to you, but there's also the fellowship as well. So if anybody wants to get into the fellowship, it's a paid fellowship. It's great experience, and it would be starting, I believe, in the fall. So yeah, anybody that wants to come to One's Up, reach out to us.
With JJPI, they do accept co-ops a couple times a year. I think they primarily gather their co-ops from Drexel and Temple, but they also, I think once you like go to the doctorate and graduate level, it's a little bit different parameters. If anyone has any questions, I have no problems getting you in contact with my preceptor, who's also the director of administration at the agency.
So just to tie this back to our theme, which is working towards equity, how do your organizations and the work that you do ultimately improve equity and the health of your community? I know some of you touched on this in your presentations, but what is the end goal of your organizations?
My organization, specifically where I work, focuses on improving access to SNAP and SNAP-Ed benefits and making sure that people are enrolled who qualified and making sure that they're receiving the information they need. And my project specifically, as I mentioned before, but just again, I want to make sure that there's kind of like one cohesive resource for people to understand impact on their community, but also resources of where they can contact people, find more information. So kind of having one overarching site is something that's important to me, because that was something that I wasn't able to find in my own research of SNAP and SNAP-Ed, specifically in Pennsylvania. So that is kind of my goal with improving health equity.
With my organization, one of the projects that I actually did in the beginning of my internship was to help with affiliate management. So I was helping contract like referral contracts with JJPI and surrounding community mental health agencies. This way, there's a more comprehensive kind of field around trauma therapy, as well as any other help the community may need for the agency, and kind of like a resource center. That's great.
We play more of a community and interpersonal health equity services, if that makes any sense. So the community organization, specifically the office that we have, is a safe space. It's always been a safe space for our youth for the last 2 years that it's been up. And in terms of like interpersonally giving our kids the information that they need to propel themselves into different spaces that they don't have access to, giving them tools around wellness. We did a lot of, recently we actually had like a rest day for our youth on our wellness day. And it got to the point where everybody pretty much fell asleep after doing a body scan, and stuff like that is really beautiful because we're promoting rest, and that's something that they really need in the community with all the stress that they deal with, all the underlying and subconscious stress that they experience. I know there's definitely ways, like other ways that One's Up, provides this, but we're still developing a lot of that out, and I'm really excited to see where it's going to take off.
Again, so I just like to open the floor. If anyone has any more questions, feel free to put them in the Q&A. And I guess I'd like to ask our other interns and Dr. S, do you all have any questions for our panelists?
I have one. Will you talk a little bit about how how the people who you serve in the community are identified, how they learn about the services that are being offered, and kind of just talk about that process, so that community engagement process that the organization has with the community.
The organization has been directly, I guess, intertwined into the community from like youth from a long time ago through connections like Hope, which is a school right around the corner actually from us, and from the village, and just connections that they've had. The founder, Alex PA, he's been associated with these youth for a long time. He's been doing this work for 10 plus years, has seen these kids since they were in 6th grade, 5th grade, if I'm getting that right, Alex, all the way up until they were in their early 20s, So he's been affiliated with the youth for a long time, and keeping in touch with those parents, we get referrals. So that's how we try to keep into the community. We're also affiliated with the Village of Humanity Arts, if I'm saying it correctly. And they have youth there as well, specifically doing arts and humanities, of course, but that are also connected to us. So we kind of like swap our youth back and forth and get our word out that way. I'm also affiliated with the Dream Program. Cassius. I'm also affiliated with the Dream Program, which is a nonprofit based in Vermont, but they do work in Philadelphia, actually on 8th and Diamond, I might be wrong, but APM is the community that they work with. It's right around the corner from us as well. So I do want to get my youth and from the Dream Program into our program, hopefully, so that they can get a paid opportunity to do the work that we're doing now.
Mine is a little bit less direct, just because it's more of like a federal process of receiving SNAP and EDT, but especially in Pennsylvania, because there are multiple providers, there's not just one. So the group I work for, PanN, is a SNAP Ed provider. So accessing benefits is through like a statewide application. And then, so it's not quite, that's not necessarily what I'm responsible for, but.
For my organization, they do operate like Tamia's as a referral through referrals. It kind of depends. So some of their services are through referrals, and this is just because with like, depending on, it's kind of hard to go through the specifics without really going through the specifics. But you can either get referred either just for outpatient services, or you can or like say in this instance, you are going to be, you just got recently incarcerated for a sexual offense. So because, and then you come out and you would like to be, you would like to go through rehab to kind of enter back into society. So at 1211, as part of the services, JJPI works with DHS to include outpatient, but also partial inpatient services as well. So it kind of depends what what you're there for and what you get referred there for. A lot of the times the patients that I have kind of seen, they get referred there just from childline reports and stuff like that. So, but there are walk-in services on Wednesdays, I think from like 10 to 12 or something. JJPI has at their 100 South Broad location, they have walk-in hours. So that is available.
Thank you all for sharing. It's really great to hear about all the work you're doing, and definitely all necessary work that you're doing. There's definitely a need for this work. So I'd just like to, congratulate you all for working so hard and dedicating your time to really be improving the health of our city. So I'll give it a minute. If there's any additional questions, feel free to put them in the Q&A. If there's no additional questions, we'll wrap it up.
I just want to add, I think everyone's doing a great job at their internships and we're all doing great work. So kudos to all of us.
So I have one, just if kind of one thing you want to leave attendees with after today. It's the one thing you want to let them know.
I can start. I think one thing that's important to think of just from like a data perspective, which I know not everyone's considering that, but stuff like census data that is kind of claimed as the census itself, but something that someone said recently was like, that is technically our data, like that is the data that serves our communities and that is representative of us. So not necessarily reclaiming it, but being aware that we are the numbers and that we can kind of take that data, and that is empowering in itself.
That was awesome. I think maybe just for my end is that there are people there to support you. There are organizations out there to support you. You're not alone. And if you need help, there will be help there for you. So.
Just that culturally appropriate work is extremely important when it comes to representation. We might think of representation as the media and who's in the movies and who's singing the songs, but representation at the community level is also important, and exposing that to the next generation coming up is really important to keep their hopes up, to let them know that when they get to our age that things are going to look better. Turning 25 is like normally like a clarity moment for a lot of people, but I just want the youth to come up and understand that once they get to a certain point in their life, you're going to turn out fine, and we do that through representation. Yeah.
All right, well, thank you everyone for attending today. I'm sure if you have any additional questions, feel free to contact our panelists. We can maybe send out their contact information if that's all right with them. I hope everyone has a wonderful rest of their day, and thank you for spending your time here to listen to the wonderful work and passionate work that our students are doing.